Bismillah Rahman Rahim. Assalamu alaikum, dear all participants and SESME members. Very warm welcome to webinar arranged by Saudi Society for Medical Education Riyadh office. I'm Dr. Shazia Iqbal, Chairperson and Head of Continuing Professional Development Activities at Saudi Society for Medical Education. In our webinar series, we always try our best to choose topics which are really in need of medical education and which are very important for coming medical educators, young generation, and more research-oriented and evidence-based. So today we have picked up a very exciting topic, and it's about lifestyle medical education in Saudi Arabia. This webinar will offer insight into lifestyle medicine education in Saudi Arabia, its importance. It will highlight about international status and competencies of lifestyle medical education in Saudi Arabia. Apart from that, our speaker will present the results of study, which is about lifestyle medicine education in Saudi medical schools. And I'm very much honored and delighted to present our distinguished speaker, Dr. Muhammad Abdullah Al-Mansour. Very warm welcome, Dr. Al-Mansour, to SESME Riyadh office. Dr. Al-Mansour is Associate and Professor and Consultant of Family Medicine and Medical Education Department at King Saud University, Riyadh. He is Fellow of Medical Education at, he did his fellowship in Medical Education from University of Toronto, Canada. He is MRC GP, and previously he has work experience as Head of Medical Education Department and Family Medicine, and served as Vice Dean of Postgrad and Research Affairs at Research Center of Basic and Health Sciences at Majma University. So I'm very much excited to have you today, and thanks for accepting our invite, and welcome to all participants. This session will be recorded, and a recording of the session will be shared with all participants at the end of the session. So I shall be moderating this session. You can keep your questions by the end of this talk, or in between. If Dr. Mansour want to get involved and put some question in chat box or want discussion, it's all up to you or how you want to run the session. So over to you, Dr. Mansour, and a very warm welcome again.
Thank you so much, Dr. Shazia, and I'm really thankful for SESME Riyadh office for this invitation and the wonderful program that we are enjoying every other week. It's really helpful, and I'm happy to be part of this series of webinars. So first of all, everyone can hear my voice. Is it clear for everyone? And my slides are okay?
Yes.
Okay, good. Good. So our topic today, it will be sort of, I want to ignite a discussion actually, rather than just give you an information. So it will be basically about lifestyle medicine education. We will take you through the literature, what's going on in the international practice of lifestyle medicine education. Then I will present to you in the second part our results of our preliminary study in this field. I'm presenting on behalf of my research team. So our outlines, our objectives for today, we're going to go a very quick overview about lifestyle medicine. What is it? What are those competencies in lifestyle medicine that we need to incorporate it in education? And what is the importance? Why we are keen to go this way? And then we're gonna go through the international experiences of lifestyle medicine education. Then we will end up with our results and our recommendation. Then I'm really keen to hear from you your input in this regard. So let's start with lifestyle medicine in general. Lifestyle medicine is relatively a new field, if we can classify it as a field. lifestyle interventions was there long time ago, since the chronic diseases raised in the community of the medical practice. Then it was just scattered as advices, some sort of intentions by physician and so on. But around 30 years back, those interactions or those interventions that targeting lifestyle changes start to be collected, and it start to build up a field that they call it lifestyle medicine. The studies in this field started in 70s, but became more rigorous and more of evidence-based from the 80s ongoing, with different scholars in this field, like Dr. Ornish, Dr. James Rapies, and others. So basically, after the formulation of the American College of Lifestyle Medicine and the publication of their competencies in 2010 in JAMA, they start to define the lifestyle medicine as the evidence-based approach to treating and reversing diseases. I'm highlighting reversing diseases by replacing unhealthy behaviors with a positive one in those 6 pillars. So please, if you can come out of this talk or quick review about lifestyle medicine by those 6 pillars of lifestyle medicine, I will be great and grateful for you and so happy. First of all, any behaviors related to nutrition, so how the people choose their food to be a healthy food, and how the people they are doing with their physical activity to be more active. What about the stressors and how they are managing their stressors and their mental well-being and emotion? What about the bad behaviors with like substance abuse, smoking, and others, and how to stop those negative behaviors? And what about the restorative sleep that is being needed? And rarely some of physicians, they are talking about sleep when they are talking about lifestyle medicine or lifestyle advices in general. And lastly, about the relationship, the social connectedness between people and how they are connected to each other, how positive and good relations affecting their life. So these are the pillars of lifestyle medicine. And from those pillars, the core competencies of lifestyle medicine that's been published in JAMA, they are focusing on the details of those 6 pillars to get more of lifestyle medicine core competency skills, how to train people toward those skills. And what about the nutrition skills? What about the physical activity with the different knowledge and skills in those competencies? What about the health and wellness coaching? It is sort of new trend to go for to have a health coaching approach and health and the wellness in general, instead of treating diseases or preventive medicine. Now we are talking about wellness with a different perspective. Then sleep health with a lot of interventions there. Mental health and emotional well-being is very important. And lately, a lot of talk about emotional well-being and mental health and burnout and so on. Mindfulness as a part of also mental health and the spiritual part of the healthy lifestyle, and tobacco and alcohol control and weight management. So those are the things that considered as the competencies, and the education will be tailored toward this. Okay, so from here, I want to go to our area as educationists. So why this field is important for us to taught our medical students, to train our postgraduate students, and also to improve ourselves as the practitioners and as educators. Why it's important? A lot of importance of teaching lifestyle medicine and training on lifestyle medicine being illustrated in the literature. But basically, we should know why it's important from its outcome. As all of us know, and now it's in fact everyone know about it, that lifestyle-related diseases, especially the chronic diseases, is really important to be tackled because it is formulating around 80% of our chronic disease. It can be lifestyle modified. And those 80% is really affecting our mortality and morbidity, and also affecting the health system and the cost of the health system. So all of these is well established, and I think everyone will know. It is well known in your mind. Also, a lot of studies came from respected societies saying that modern medicine needs to address the underlying causes with a new medical specialty, and they call it lifestyle medicine. So it's we cannot tackle those problems with our previous weapons, if we can say. We need to have something collecting all of these lifestyle interventions under one umbrella and modifying those research toward this. And they found this in lifestyle medicine. A lot of devastating data showing that how big the magnitude of the lifestyle-related chronic diseases, and how failure we are in the stages of preventing those diseases. Like being presented in International Journal of Clinical Practice in 2014, lifestyle medicine potential for reversing a world of chronic disease epidemic. So now we start here words like reversing, like remission. It was really a dream for those being in practice for 30 years, 25 years, and less. We know that talking about reversing diabetes, reversing hypertension, reversing the peripheral arterial diseases was like a dream. But nowadays we have a significant amount of data showing that people, if they are stick to lifestyle medicine approach, they are reaching those stages of remission, and this is really amazing. So from this, the importance of teaching ourselves as a medical community about lifestyle medicine is important, has been stated in this review article in Analytic Review about medical education in lifestyle medicine is a necessary intervention to allow health providers to learn how to effectively and efficiently counsel their patients toward adopting and sustaining healthier behavior. So it's not anymore telling the patient at the end of the consultation that, okay, watch your weight, watch your diet, and just if you can just walk or do some exercises. Those general advices is not anymore accepted because it is not based on scientific, well-established instructions that packed with a bunch of evidence that now we have it. So the good thing that we have this, but we need to educate ourselves and our students towards it. So as I said in the beginning, so lifestyle medicine teaching or education, it it can be there in all the continuum of the education, starting from the undergrad, in the postgraduate studies, in the fellowship, and also in the professional development. We need to address those issues. We need to put a lot of programs and curriculum and CBDs and so on. And it should not be only for medical education. I mean, not only for those people in the medical school, but the interprofessional lifestyle education also, it is there on the road. And now we have a lot of collaborative practice, interprofessional practice coming to this area of lifestyle medicine, because simply it is the area that easily can collect everyone from different specialty or different profession toward one goal. We have the nutritionist, we have the physical therapist, we have the physical coach, we have the health coach, we have the health educators, we have the nurses, we have the sleep medicine personnel and sleep medicine specialized people, psychologists. All of this wonderful collection can be working together toward a goal of lifestyle medicine education. So it is a big field for those interested in interprofessional education to build up a curriculum and go and provide it for everyone. So again, one more reasons that why we need this, as it's been stated by American Heart Association in 2016, very important statement that they said, we propose a framework for us, for U.S. medical school deans and program directors to integrate learning objectives that will improve lifestyle counseling competency among future physicians. So American Heart Association, they realize that it should be there from the start in the framework of the curriculum. So this is very important shift in the lifestyle medicine education. And also in medical teacher, the wonderful article being published talking about the physician and providers need to develop more competencies in lifestyle medicine, and CMEs and CBDs, if we can say in the other countries, and lifestyle medicine can result in reduction of barriers to practice and increase knowledge, skills, and implementation of lifestyle medicine intervention. So people start talking about it. And this is one of the studies that they make a trial. And they show that 28 physicians trained to apply nutrition intervention. It's part of the lifestyle, not the comprehensive one, but just only one part of it. Nutrition interventions on their patients, and significant improvement in metabolic indices seen in the compliant patients regarding obesity, hyperlipidemia, and hyperglycemia. And as I said in the beginning, we have a very wonderful longitudinal cohort studies showing that we have a remission from diabetes and control hypertension with only controlling the lifestyle attitude and behavior of the patient. And now the things start to grow, especially in the Europe and North America. And this article published in Preventive Medicine, American Journal of Preventive Medicine, they mentioned that although this movement toward lifestyle medicine, but still the medical school and medical educators in the US, they are still lagging behind. They are not catching with this move. And they stated that 10% of US medical educators perceived that their students had the competency and skills to create and prescribe an exercise prescription for health. This is one also of the example of the intervention. We call it exercise prescription, okay? And unfortunately, only 47% of those people, those educators, they ranked this as an important. So still, we are talking 2019 publication. So still people need a lot of awareness, a lot of buy-in for this type of intervention. American Medical Association, they stated that medical school curriculum reform must include training in lifestyle medicine, and they make it clear that it is a must to include lifestyle medicine in their curriculum. this was published in 2019. Before that time, there were a lot of initiatives started from 2008 and being reviewed 2013 and 2015. This article being published, and they screened the US medical school, and they try to find how many schools they just adapt to the recommendation. And they found that 27% of US medical school, they are complying with the recommended 25 hours of nutrition education, and only 6% of medical school address exercise prescription in their curriculum. So very few percentage. But the snowball is rolling, alhamdulillah. 2004, American College of Lifestyle Medicine established. 2007, the Institution of Lifestyle Medicine in Harvard Medical School established. Loma Linda University, they established the first program of lifestyle medicine around 2007, 2008. Then the big achievement of publishing in 2010, the physician competencies for prescribing lifestyle medicine was published in JAMA. And it was really a big move towards having lifestyle medicine as essential part of the curriculum for undergrad and postgrad medical graduates. So as I said, a parallel curriculum in lifestyle medicine being provided by Harvard University, and they have a wonderful program there. University of South Carolina, one of the leaders and initiators in this field, and they are including lifestyle medicine in undergrad medical curriculum. Also, the Dutch people, they start to realize the importance of lifestyle medicine, and they include the nutrition education in their curriculum, and they call it self-course student experience in lifestyle and food. And they give it 25 contact hours over 10 weeks. And they measure the result. It was wonderful. One of the creative way of international experiences to include the nutrition education, for example, in the era of global obesity, and they include a creative way of including nutrition education. They started from the genetic evaluation of predicted risk for certain population, going to the in-hospital outpatient centers. Then they built up exercise and movement therapy centers, adopting those lifestyle interventions. And really, I do like this way of creative thinking. They create what they call it teaching kitchen. So they are not just giving a theoretical point of nutrition. They take the students and they also go to the high school and the elementary school, and they try to make it more interactive and getting to the kitchen, preparing the food, and so on. And also, this is also applied to the other interventions of lifestyle medicine. So people start doing this in interactive, creative way to make it more acceptable and to gain more of buy-in. Also, one of the important aspects of lifestyle medicine education is, as I said in the beginning, it's not being only fixed for medical school. It is also going beyond the walls and the boundaries of the discipline and profession to have the collaborative learning and the interprofessional learning on board, to involve people like what's been published in this two articles, implementation of an interprofessional nutrition workshop to integrate nutrition education in preclinical medical school curriculum. So they involve people from different professions toward this goal. Collaborative learning activity utilizing evidence-based medicine to improve medical student learning of lifestyle management of obesity was one of the nice experience that's been published and showing the collaborative practice in such field. And also the collaborative practice going beyond the country boundaries. Also, they start to expand globally, and they published in 2016 what they call it Advancing Lifestyle Medicine Education in Undergraduate Medical School Curricula through the Lifestyle Medicine Education Collaborative. This collaborative was really interesting because it was involving champions from across the globe. And Alhamdulillah, Saudi Arabia was one of them. This is 2016. I just want to remind you. Now we have more than one champion. We have a lot of movement toward lifestyle medicine. Alhamdulillah, in Saudi Arabia now we have lifestyle medicine fellowship being established under the Saudi Commission of Health Specialties, and they already started. Alhamdulillah, we have also a movement toward establishing lifestyle medicine clinic, like for example in military hospital. Dr. Ayman Afifi and his colleagues, they are doing a great job, and they publish a lot of articles in this. We have Dr. Saleh Al-Radhi and the group of lifestyle medicine. We are glad to present this presentation in the first international lifestyle medicine conference last year, March 2021 in Hail. It was wonderful, 5 days conference, and a lot of activities being done there, and a lot of thoughts from different perspectives. One of them, I presented this presentation, and a lot of good input came out of that conference. One of them is, inshallah, we will see the Lifestyle Medicine Society soon, inshallah. And in the region, we have also a good move in Gulf country. We have Al Ain University, United Arab Emirates University in 2004, 2007. They implement what they call it strengthening public health medicine training by development of evaluation of lifestyle curriculum. So they implement a sort of lifestyle medicine education component in their curriculum from the first year of undergraduate medical student. But this part is not exclusive for lifestyle medicine. It's been like a sort of longitudinal over the years, including the other part of the public health, like epidemiology, research, and others. But the lifestyle medicine component was addressed early, and they published their experience, which was a good start in this regard. So this is the end of the first part of my talk, talking about lifestyle medicine in general, and lifestyle medicine education, what's going on in the international literature, and what's going on in the region. And now, I will take maybe the other 10 minutes. I will not take more than this, inshallah, talking about our study. Our study was started as a research group formulated from interprofessional experts in February 2021. Our focus was mainly about lifestyle medicine education research. We are now, alhamdulillah, in phase 2, and we are about approaching phase 3, but I will just present it to you phase 1 product. Our aim in phase 1 project was to explore in general the general status of lifestyle medicine education in medical school. We just go to the medical school. Inshallah, we will go beyond the medical school to the other healthcare schools. And our method was to surveying the 37 medical colleges, public and private. We asked the program directors or the head of medical education department about their curriculum and how they are teaching lifestyle medicine in general, and how they are teaching lifestyle medicine competencies in specific. And alhamdulillah, this work being now submitted, inshallah, it will be published soon. So I will share with you our results. Those are the preliminary results that came out of this. We got 34 responses from our colleagues. and maybe some of them they are with us tonight, and I would like to thank them all for their response. And we just calculated, we analyzed 29 out of the 37, which is a pretty good response rate, 78.3% of the medical colleges program directors, they answer our questionnaire. And their demographic and practice data just showing that we are dealing with expert people around 15 years in the academia. Most of them, either they are vice dean or program or the medical head of medical education by their position. And the interesting thing that most of them, they are stating that their MBBS program adopting the hybrid or PPL based or education. So most of them, they are in the era of the new curriculum. And most of their students, they are male and female. And most of their students, they are coming from the high school. Our main results of that study was about the awareness of lifestyle medicine competencies. We found that 62% of the program directors of MBBS in Saudi Medical School, they said, yes, we are aware. And when we asked them, do you have a specific course or module or block to teach lifestyle medicine, as we expect in our hypothesis that most of them, they said, no, we don't, 86%. Few, they said, yes, we do have a specific course teaching lifestyle medicine. So then we go deep in the lifestyle medicine competencies, and we found that nutrition is the highest one as a whole course. Health, wellness, and coaching, we found it interestingly in one response. Physical activity in one response as a whole course. But as we expected, that most of the competencies being taught as a part of the course. So it's been there in all the competencies, and some of the competencies that not being taught, I mean, relatively less than the others, like, for example, the health and wellness coaching, the mindfulness, the sleep health is less integrated in as a part of the course in our curriculum. Regarding the credit hours, they are ranging around 5. They are regarding the contact hours, there are some variety of the responses ranging from 70 to 100, some of them exceeding the 100. And again, this is the self-reporting. So we just display the result that we got. Age of the course, how long have you been teaching this? Average of 6 years. And how long this course has been taught, and from ranging from 3 to 8 weeks for different competencies. Nutrition, as you can see, and alcohol abuse, interestingly, has been taught for a long time. So this is a very interesting result. We need to go further and dig more about those people answering those questions, and we are really keen to know more about those courses. Program learning outcome. We asked our participants how linked your course to the PLOs, and we found most of them that it's been linked to at least 1 or 2, and ranging from 1 to 5 PLOs. What about the CLOs? Again, good amount from 2 to 5 CLOs being linked to the lifestyle medicine competency. When it's coming to teaching and learning methods, we classify to lectures, small group learning with different modalities, clinical teaching, and large group learning sessions and practical labs. We found that the highest frequency is for lecture, followed by small group learning, followed by clinical teaching with different modalities, followed by large group learning like seminars and tutorials, followed by practical labs. When it's coming to assessment methods, most of the assessment of lifestyle medicine competencies was made by written MCQs or short answer, short essay questions. So most of it was going toward the written exam. Some OSCE, some assignments. Some people say that essay questions also can be fit to the written part. So again, written part is dominating here. Oral exam, BPL checklist, some of the participants say that we are using it. So what does those results mean? It simply means that we are under teaching lifestyle medicine as a whole, as a comprehensive unit. It is still under teach in our medical college. But the good thing that we have a fair distribution of lifestyle medicine competencies in our curricula, but it is in a scattered manner. So we can find it, for example, in public health course, we can find it in family medicine course, we can find it in internal medicine, we can find it in maybe in respiratory courses and basic years. So I don't know. We need it's been scattered, and this needs to be followed with the follow-up research. As I just mentioned, that the lectures and the written assessment was the dominant one in teaching lifestyle medicine competencies. And here we need to rethink about it. Is this the better way to teach and assess lifestyle medicine competencies, or we should adopt different creative methods? We can make it as a field study and so on. This is maybe an area for research for the coming future. So I will conclude by, sorry, I don't know what, yeah, I will conclude, sorry. I will conclude by the conclusion and recommendation. So our conclusion is that lifestyle medicine education is a necessity, not luxury anymore. Saudi medical schools should incorporate the comprehensive form of the concept of lifestyle medicine. Lifestyle medicine competencies are matching the Saudi med, and this is very reassuring. When we try to match the PLOs of Saudi med with the lifestyle medicine competencies, we found that it is like if we take it like just a general look, it's very well matched, but we need to have studies in this model to show it. And also the model of care that's been proposed now by the transition in the MOH practice in Saudi Arabia, I'm talking, it is matching with this because we have three pillars of the model of care, talking about well-being, mental well-being, and healthy young adults, or healthy adults and healthy elderly. It's all also been incorporated in lifestyle medicine. Finally, interprofessional, collaborative, and community-based approach of lifestyle medicine education, it could be probably the way, because it is really a very rich field, as I said, for interprofessional and collaborative work. By end of this, I would like to acknowledge my research team, Dr. Hayat Zahrani, Dr. Abir Zeben, Dr. Sadim Al-Jammaz. They were really a great contributor to this. And I'd like to thank you all. And here's my, you can scan this QR code and contact me. And this is my email. And I would like to stop here and hear from you. Thank you so much.
Thank you so much, Dr. Mansoor, for this such a wonderful presentation. I would say that it is such enlightening the way you have taken us through literature and the way you have taken us through significance of lifestyle medicine, and especially the way you have worked in Saudi medical schools to get this literature. I would say that Saudi medical schools, they are doing great job if they say that 80% above, they know, they are well aware about lifestyle medicine, although application is less, but somehow in scattered in few courses they are doing. That's really great job. So we are happy to take questions from audience. So please feel free to raise your hand and chat box. It's about Dr. Faiz Ali Shah. How can lifestyle medicine be included in medical education curriculum at undergrad and postgrad levels? I think you have touched more about it because it's the question of all curriculum developers, that how we can take initiative to develop this course within undergrad and postgrad medical curriculum.
Yeah, thank you, Dr. Asad. Your voice were interrupting, so I could not hear you all, but I can read it from the chat. If you are asking about how to include or incorporate the lifestyle medicine competencies in undergraduate, I think this is very good question. If we start asking ourselves about this question, we will find the way, because lifestyle medicine is like the other components that became needed to be injected in our curriculum in the undergraduate, like, for example, patient safety. Now it's been illustrated and very well welcomed in undergraduate medical curriculum. We have now upcoming challenges in our medical practice. It will mandate this. So I think the way is first to recognize the importance of it, and our study was just to highlight this. Then secondly is to match with our framework. If we are talking about Saudi context, we have the Saudi Med, and Alhamdulillah, it's covering this part, and we need just to blueprint this and matrix with the Saudi Med and start to implement it either as the part of a course or as a whole courses. So I think there is a huge room for this, and we need to make a difference to let people and students enjoy it and interact with it. And here, what I'm really proposing, that we need to make it different. Not only lectures, not only knowledge. We need the student to take it to the ground, like what we did in High conference. We were lucky that we are eating healthy food in the conference. We are going to walk in the around the hotel. We went to a hiking trip with the group. It was wonderful. So it was really we are applying what we are saying. So walking our talk, I think it's our way. Maybe in our medical school, we should be creative. And there is a long journey to doing this. Thank you.
Yeah. I hope it answered to your question. A lot of thanks are there in our chat box. It was great presentation, fantastic. Thank you so much. Dr. Mansoor, I just need your opinion on that, because if we look into our medical students when they are in their whole journey of medical education, 5-6 years at medical school, by end of final year, like they are totally drained, very much stressed, especially stressed about their future, a lot of apprehensions about internship, placements, and stress management is one of the biggest thing which we have to teach our medical students, so that they are in good position and emotional stability, that they can give a good quality of care to patients. So we in our medical school, we gave thought once to introduce elective course, the mindfulness, But however, we couldn't apply that. But still, what is your opinion that why not to take lifestyle medical, this medical education as an elective course at different levels in curriculum?
Yeah, thank you, Dr. Shazia, for this question. Yeah, I think this notion is being raised with a lot of those challenging topics that's coming. Like what I said, like with the patient safety. First of all, people they said, okay, can we make it elective? Shall we make it mandatory? Then the mandate came from, for example, from the SMLE, Saudi Medical Licensing Exam framework. So we try to match it with our graduates. So my point here is, I think anything to start is acceptable. So just to break the ice in the beginning, to just expose the student to this field, and how to incorporate it to make it like what American Heart Association said, that it should be a must. So I think with the gradual injection of lifestyle medicine competencies, I think we can reach that it can be one of our courses that can be a longitudinal course. It can be elective in the beginning, yes, I agree, but it should be ended as a mandatory course. Why I'm saying this, not just because I'm biased with lifestyle medicine, but because if you think about it, what we are doing in all of other courses, internal medicine, family medicine, surgery, pediatrics, OB/GYN, all the other major courses, we are exactly treating the chronic diseases. And all the recommendations, without any exception, they mention clearly that lifestyle intervention is the first step to do. So that means I want to graduate my students out of medical school with the clear concept when they hear lifestyle, what does it mean and how to do it and how to follow it. So I think with the time, and I'm optimistic here, with the time, I think it will be part of the initial practice, and we will find ourselves doing it as a must. But how to just anticipate from now, I think doing it as elective is good. Concentrating in competencies to inject it in different courses is also another good practice. You mentioned about the student stress. I think student stress can be handled in two ways. So their own stress, how to handle their stress, and this being tackled with the well-being of the students, support units, and so on, and also how they figure out the stress in their patient, and how to try to help their patient to adopt and develop some behavior changes towards controlling their stressors and coping with their stressors. It is also another story. So there is a lot of room for this practice.
Yeah, exactly. So to me, I think that is equally important, just like we are enforcing that in our curriculum longitudinally, we have to train our medical students or medical trainees on improving their professional attitudes, their communication skills, collaborative skills. So I think integrating in a longitudinal way throughout the curriculum is one of the best. No doubt in different aspects, in different courses, we are talking about lifestyle, but here, there maybe that is not very much highlighted, or their significance is lost at that time. So I do agree with you, the way you have mentioned that it should be in longitudinal way. We do agree. Any other question from participants? Please feel free to raise your hand or get involved in discussion. Thank you so much, Dr. Ahmed, for sharing Saudi Commission for Health Specialty link and files. And we are really pleased the way Saudi Commission is supporting into it. I'm not much aware when it was conference. You mentioned it was in Hail, so it was specific to this topic, or this component was part of that?
Yeah. I think Dr. Al-Hadithi, he just put the chat for in the chat the lifestyle medicine,
Link.
yeah, the lifestyle medicine fellowship, which I mentioned in my presentation. So we are proud. We are proud that we on the level of the postgraduate, at least we take this step in Saudi context. I hope, inshallah, this movement will be also implemented in all the continuum, as I said. So it is not only the undergrad, not only the postgrad or the fellowship of the postgrad. We need it to be there in all the continuum, because we are dealing with this 80% chronic diseases every day in every specialty. So yeah, I think it's a good start. It's a good start, and I hope, inshallah, it will be continue. Thank you. Thank you, Dr. Ahmed, for putting it.
So I can see that there are no more questions. So I saw there was one graph which you mentioned that in Saudi Arabia, or is there any kind of collaboration between this society which you are planning to create within Middle East about lifestyle medicine?
Yeah, absolutely. I think we have a very good connection with the American College of Lifestyle Medicine and the American Board of Lifestyle Medicine. The founder of American Board of Lifestyle Medicine, he was one of the guest speakers in HILE conference last year, and he is working with us actually, alhamdulillah, in the research group. And yeah, we need more of this collaboration and international and regional. This field needs to be pushed to the ground, to the surface. I think it is really needed with also the help of the medical educators. And that's why I'm really keen to present this in your forum, because I think the medical educators, they are really important to make this field flourish in the future, at least in our Saudi context.
Yeah, exactly. You're very right in that point. So we have taken up all questions, and I'm really pleased to have a wonderful conversation and wonderful presentation. It was really amazing, I would say, and very much structured and needed. So we shall be waiting for your publication, and we really congratulate to all of your team who worked hard on this topic, and you brought up very important issue for medical educators to think, and this is time for us being curriculum developer and faculty developer to talk and further elaborate and enhance this issue, that this is needed and we need to make certain reforms to integrate lifestyle medicine longitudinally, especially in our courses or short courses or elective courses. There is one comment. There is one comment where Dr. Ahmad, I believe that such a great national effort, we would be able to nurture our students to explore promising field. Definitely, congratulations. So thank you so much, Dr. Mansoor, for taking your time for this wonderful presentation. And definitely, I will be sharing recording of this presentation with all of you and yourself as well. Have a good night. Thank you. Bye-bye.
Thank you.
Bye-bye.